Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Shivesh Thakur, gastroenterologist at Eminent Hospital, Indore, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective, evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us. Let's begin our discussions.
नमस्कार, मेरा नाम डॉक्टर शिवेश ठाकुर है और मैं एक कंसल्टिंग गैस्ट्रोएंटरोलॉजिस्ट हूँ एंड करंटली इंदौर में महालक्ष्मी नगर एरिया में मृत्युंजय गैस्ट्रो क्लिनिक में कार्यरत हूँ.
So, doctor, question for you is, what exactly is IBS and how would you describe it in simple terms to a non-specialist?
IBS ultimately it means irritable bowel syndrome, as the name suggests. It is a hypersensitive gut. There is no any structural changes in the gut, but there are some functional changes leading to symptoms. So it is basically hypersensitive gut leading to symptoms in the form of abdominal pain, altered bowel habits in the form of diarrhea or constipation, bloating, and epigastric pain.
Why do you think IBS remains one of the most underdiagnosed gut conditions in India?
Yes, IBS is one of the most underdiagnosed condition in India because the symptoms of IBS overlaps with many of the common conditions occurring in India, like infection, GI infection leading to diarrhea, abdominal pain, bloating, and gastritis. All these symptoms overlap with symptoms of IBS. So that's why IBS is underdiagnosed condition.
In your experience, how does a typical IBS patient present in an OPD?
Typical IBS patients comes to OPD with chronic history of abdominal discomfort or bloating associated with altered bowel habits in the form of diarrhea or constipation, and also all these symptoms correlate with bowel habits like relief by defecation or aggravate by defecation.
How does modern lifestyle food habits, stress, and sleep contribute to IBS?
Yes, so modern lifestyle and food habits and circadian rhythm, they contribute to IBS because it is functional GI disorder. So it is a disorder of gut-brain axis. So whenever we consume more and more processed food, outside street food, oily food, so it disturbs our gut microbiota and leading to hypersensitivity of our intestine and leading to symptoms of IBS. And also the stress also leads to altered sensitivity of our intestinal system, leading to symptoms of IBS.
How important is the patient's history compared to investigations in IBS diagnosis?
Patient history is utmost important in the diagnosis of IBS because IBS can be diagnosed on the simple history basis because it is the disorder of function. So just the ruling out of other diseases like organic cause. So IBS typical symptoms based on Rome 4 criteria, we can diagnose IBS and we can avoid over prescribing the investigation.
What are some common mistakes in diagnosing IBS at the primary care level?
The common mistakes done in diagnosing IBS at the primary level is both kinds. First is under-diagnosing IBS and second is over-diagnosing the IBS. Over-diagnosing IBS means labeling patient is having IBS without ruling out other organic cause of diarrhea. And the under-diagnosing IBS is like not labeling patient is having IBS without asking proper history and subjecting them to more and more investigations and also prescribing antibiotics and antacids.
Are there any warning signs where a physician should immediately refer to a gastroenterologist?
Yes, there are some warning signs when the primary treating physician should refer the patient to gastroenterologist, and these are like weight loss, blood in stools, bloody diarrhea, fever, abdominal pain, family history of colonic cancer, and nocturnal diarrhea, diarrhea in the midnight. So, and also the weight loss. So, these are the red flag signs. Whenever someone detects it, they should refer it to gastroenterologist.
What's your opinion on the role of rifaximin in IBSD? Where does it fit best?
As per the studies and the recent data, rifaximin is the non-absorbable gut-specific antibiotic, and it has a proven role in IBSD, like diarrhea type of IBS, where it is because of the dysbiosis of gut microbiota. So it can be given in mild to moderate cases as a standalone therapy, and in severe cases, it can be given as an adjunct along with food therapy, food modification.
How important is patient counseling in IBS management? What key messages do you give?
Patient counseling in IBS is very important because most of the time these patients are they are told that they are not having any disease. The tests are coming normal, so you are not having any disease. But no, they are having symptoms. So there is a clear-cut label entity as IBS because their intestinal system is oversensitive. So they should be told about that their intestinal system is sensitive because of the stress or the food related factors, or sometimes because of some infection. So they should be told about these things, and also they should be educated about to relieve the stress, and healthy food habits, and also healthy exercise, and the lifestyles.
What's the role of diet? Do you recommend low FODMAP, fiber modification, or any particular dietary pattern?
Yes, definitely. Diet have a big role in the management of IBS because the diet it causes the dysbiosis also, and also the formation of methanogen producing bacteria leading to symptoms of IBS. So low FODMAP diet is important, containing oligosaccharide, low in fermentable oligosaccharide and monosaccharide and polyols, and also reducing the food containing ultra processed food and oily and street food.
Do probiotics or prebiotics have a role in IBS treatment?
As per the studies, they have some role in treating mild cases of IBS, especially IBS-D type or diarrhea predominant type, but not as much as the major role is not proven in management of IBS. But definitely in IBS-D, probiotics have some role.
How do you handle a patient who doesn't believe IBS is real?
Whenever a patient comes and he doesn't believe that IBS is real, so I tell him that it is the disorder of your gut-brain axis. So your intestine is oversensitive because of some stress and your food habits, and due to some other infection-related issues. So that's how I make them believe that it is the disorder of gut-brain axis. It is real.
What's your message to young doctors who hesitate to label a case as IBS?
My message to young doctors, because as IBS is very common in Indian population, up to the tune of 20% general population is suffering from this disease, and also they are subjected to battery of investigations, flurry of investigations before labeling them to IBS, and it adds up in the cost to the management. So just don't hesitate labeling a patient as IBS. Just apply Rome 4 criteria in diagnosing IBS after ruling out the red flag signs. So it is my message to young physicians.
The most common mistake you see in IBS management?
Most common mistake I see in management of IBS is considering a patient is having infection and giving antibiotics without any rationale.
One food you tell IBS patients to avoid? One myth you'd like to bust about IBS?
Avoid taking ultra processed food, pre-cooked food, and also a high FODMAP diet, and the lactose, the milk products. And the myth I would like to bust about IBS is it is the entity, it is the disorder of gut-brain axis, and it should not be taken as a psychiatric problem. It is definitely it is related to intestine. So these are the symptoms because of hypersensitivity of your gut. So these are the some points I would like to break about the myths about IBS.
What's your gut friendly morning habit?
My gut friendly morning habits is having a fixed cycle of sleep and waking up in the morning. Maybe it any kind, but should be having a fixed sleeping cycle and sleep and wake up cycle. Along with that, healthy breakfast, not a heavy one, and then physical exercise and healthy food, not processed food or outside food. Home cooked food is the best one. Thank you so much.
Thank you, Doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert led conversations. Until then, take care and prioritize your gut health.